Hello viewers and my dear students, I welcome you all. Today's topic of discussion is obstructive jaundice. It is a condition in which there is blockage of the flow of bile out of the liver into the intestine. This results in redirection of excess bile and its byproduct into the blood, and bile excretion from the body is incomplete. Bile contains many byproducts, one of which is bilirubin, a pigment derived from dead red blood cells. Bilirubin is yellow, and this gives the characteristic yellow appearance of jaundice in the skin, eyes and mucous membrane. Now the etiology or the causes could be prehepatic, hepatic or post-hepatic, that is obstructive or surgical jaundice. Other factor could be gallstones, cancer of head of pancreas, periampullary carcinoma, cholangiocarcinoma, pancreatitis, biliary stricture, or the compression by the metastatic lymph nodes, tumors or hydatid cyst. Symptoms present are itching, intense itching, that is pruritus, right-sided hypochondriac pain, fever accompanied with chills, rigor, lethargy, anorexia, nausea, vomiting, bruising from the skin, easy bleeding of the gums, scratch marks, ulceration are due to the deficiency of vitamin K, that is fat-soluble vitamin. There is pale stool and dark-colored urine. Urine bilirubin is normally absent. When it is present, only conjugated bilirubin is passed into the urine. That's why there is dark-colored urine seen in patients with obstructive jaundice or jaundice due to hepatocellular injury. Lack of bilirubin in the intestinal tract is responsible for the pale stools, typically associated with biliary obstruction. The cause of pruritus is associated with biliary obstruction due to accumulation of bile salts in the skin. In physical examination, there could be presence or absence of ascites and collateral circulation associated with cirrhosis. High fevers and chills suggest a coexisting cholangitis. In physical examination, patient may display sign of jaundice. When the abdomen is examined, the gallbladder may be palpable, that is Corvoisal law. This may be associated with underlying pancreatic malignancy. Also look for sign of weight loss, occult blood in the stool. Now what is Corvoisal law? In a jaundice patient, if the gallbladder is palpably enlarged, it is not due to stones. In case of stones, previous inflammation would have made gallbladder fibrotic, hence not palpable. In general examination, there will be features of scratch marks, pedal edema, clubbing and jaundice. In inspection, gallbladder will be palpable. In investigations, we will go for the liver function test, antimitochondrial antibody, hepatitis serology, hemoglobin will be low, VT-CT, PT are altered in cases of obstructive jaundice. Urine for urinobilogen is negative in obstructive jaundice. Serum alkaline phosphatase normal value is 60 to 300 unit per liter, but more than 500 unit is a suggestive of obstructive jaundice. Stones can be diagnosed with their posterior acoustic shadow through abdominal ultrasound. It can also detect the secondaries in the liver. Portal vein infiltration can be demonstrated by CT scan. Endoscopy is useful to diagnose a periampullary carcinoma, which may be seen as an ulcerative lesion in the second part of the duodenum. Direct cholangiography done by percutaneous transhepatic cholangiography and endoscopic retrograde cholangiopancreatography provides most anatomical detail of biliary tree. It enables inspection for filling defects, stenosis and occlusion. Barium meal is also a very good investigation, usually done to investigate the C loop of duodenum. In carcinoma of the head of the pancreas, there may be widening of the C loop of duodenum, that is PAT sign. Complications could be cholangitis, coagulopathy, pancreatitis, liver cirrhosis or cholestasis with pulmonary stenosis. Treatment options for obstructive jaundice depend on the exact cause of the jaundice and on the severity of the disease. Antibiotic therapy is given. Endoscopic retrograde cholangiopancreatography, that is ERCP, is an imaging procedure that allows treatment of some bile duct problem, including removal of gallstones that are causing obstruction. Intravenous fluids along with the painkillers and adequate hydration is done before the surgery. Injection of mannitol is given to prevent the hepatorenal syndrome. Also, injection of dopamine is given to improve the urinary output. Injection of vitamin K is given to correct the prothrombin time. Adequate blood transfusion is done to correct anemia. Surgery or other procedures are done to repair anatomical defects or create alternative pathway for the flow of bile. If cancer present, then the treatment includes radiation therapy or chemotherapy. Transplantation of the liver if all other methods get unsuccessful.